Hello, my name is John Haynes. Welcome to Zane Radio, audio reports from Zane's friends and partners on the ground in Zimbabwe. Mary works for one of Zane's partner organisations, focusing on work with pensioners. I began by asking her for some background to her organisation.
In 2008, this country experienced one of the highest inflation rates ever recorded globally. The economic fallout from this had a devastating and long-lasting impact on the elderly people of Zimbabwe, many of whom lost their entire life savings. For the past 15 years, our organisation, with the generous assistance of our donors, has been taking care of these people who would otherwise be destitute. Today we are faced with another crisis, the coronavirus pandemic. This comes at a time when the Zimbabwean economy is barely functioning and its healthcare system has virtually collapsed. As the winter approaches, our organisation is bracing itself for a health crisis of unprecedented proportions, and we are deeply concerned about the long-lasting impact that this will have on the people that we care for.
Thank you. And who do you help?
I have worked with this organisation since 2007, and I am proud to say that over the years we have made an enormous difference to many elderly people in Zimbabwe who would otherwise have been forgotten. Our team offers help to elderly people who are still able to live at home. We also assist those in nursing homes who are no longer able to manage on their own. We provide them with funds for food and medication and help them when they need to see the doctor or pay their medical aid cover when they can no longer afford to. In some cases, we have helped them to sell their houses and to rehome their beloved animals so that they can move into frail care facilities. We have been with them all the way, and we have even attended their funerals when they have passed on. For others, we have assisted with paying their fees in nursing homes. In fact, we have even provided financial support to the nursing homes themselves, many of which are struggling to cope with staff salaries and rising costs.
What particular problems are you facing at the moment?
The social, economic and political landscape of Zimbabwe is enormously complex, and it frequently presents a number of challenges to our work. Over the years, we have learned to problem solve and to cope with the many difficulties that come our way. As a community, we have had to deal with the shortages of medication, inflation, devaluation of currency, and food shortages. A never-ending cycle of power failures means that we only have 5 hours of electricity a day. We have had to contend with hours spent in long queues because of fuel shortages. Our resilient team has always believed that, despite the daily challenges to our work in Zimbabwe, we will always make a plan and find a solution. This attitude of resilience was recently put to the test when the first case of coronavirus entered Zimbabwe. Our team realized immediately that we were facing something larger than we had ever seen before. Furthermore, we recognized that our country was totally unprepared for this crisis. Our best and only defense against this disease is prevention, staying at home and practicing social distancing. This is much easier if you are living in a freestanding house in an affluent suburb, but it is virtually impossible if you are living in a high-density suburb where you have a family of 10 living in a 2-room shack with no running water and no sanitation.
What effect is coronavirus having on those that you are helping?
One thing we can all agree on is that the healthcare infrastructure in Zimbabwe is grossly under-equipped to deal with this crisis. Our team is well aware that it is our pensioners who are most vulnerable to this pandemic. We have worked frantically over the past few weeks to get financial aid, food, medicine and masks to our elderly before the 21-day lockdown period. We hastily arrange for people's medical strips to be renewed, and at the same time we try to explain the seriousness of the virus by providing information to people about protection and safety. Many pensioners live on their own and some do not own a car. We are hugely concerned about how these people will manage during the isolation period. Many don't even have electricity, and the only lights that they have are from the solar lamps that have been provided by us. Our team has put measures in place to monitor those who are vulnerable and those who are living on their own during this lockdown period. Volunteers are delivering food and medication, and we are keeping in touch with regular phone calls. Many of the people that our organisation takes care of no longer have any family left in this country. If they become ill or run into difficulty, then they generally call us because we are their only support.
Could you maybe give an example of someone in particular that Zane are helping?
One example is a couple who I will refer to as Brian and Margaret. They live about 20 kilometres outside the city. Margaret has recently returned from hospital after a bad episode of pneumonia. The cost of their life-saving medication is in the region of $200 per month, which is paid for by our organisation. Brian and Margaret live in a very isolated place, and until recently they were not even aware of the COVID-19 pandemic. These people, like many of the elderly that we care for, are in a very high-risk group. The least we can do for them now is to keep in contact and urge them to stay at home.
Thank you. And finally, what is your message to Zane's loyal supporters?
The challenges of caring for the elderly in Zimbabwe have always been difficult. However, it has recently become a great deal harder with the arrival of COVID-19. Despite this, our team is resilient and we are determined to tackle this problem in the same way that we survived hyperinflation. We will make a plan. For many years, we have walked the journey with our pensioners from a place of fear and loneliness to a place of safety. Our team will not be giving up at a time when our assistance is needed most. We will keep walking with our pensioners, and we hope that our sponsors and our donors will continue to walk with us. Thank you.
Thank you for listening to Zane Radio. Please donate to Zane at www.zane.uk.com. Music was by Kevin MacLeod at incompetech.filmmusic.io.